As part of our series on oral health on Mesa Health and Medical, we meet with Dr. Keith Macdonald and Dr. Robert Macdonald of Macdonald Orthodontics to learn more about the practice of orthodontics and the changes and advances in the industry. With advances in technology and more cosmetic treatment options like ceramic, clear braces, and Invisalign, orthodontic treatment is no longer just for the young. Quite the opposite. More and more adults continue to seek orthodontic care to address dental issues that have concerned them for years, or to prepare their teeth for veneers or implants planned by their dentist.
Probably the fastest growing area of our practice is adults. I would say up to about 20% of our practice now are adult patients. And honestly, they are really some of the funnest patients that we treat. And the reason is that they really are into it. That's something they've wanted for a long time, and very compliant with what we ask them to do. I think there's several reasons that orthodontics is getting more and more popular in adults. Number one would probably be Invisalign. Adults that don't want to wear braces see this Invisalign product and they come in and want to know about it and see if it's right for them. I think the other area that's gotten, especially in the last couple of years, a lot more attention is the fact that dentists understand that orthodontics can play a really vital role in rehabilitating the dentitions or the teeth of adults. And we call it interdisciplinary or multidisciplinary treatment. But we work directly with dentists and talk about how we can get the smile that adults really want.
There are differences between treating children and adults, and it's important to see an orthodontist who is experienced in both.
One of the main differences is children grow, adults don't. And that can be a big factor in some of the ways that we treat individuals. There are some malocclusions, some dental conditions that require growth to assist in the completion of their treatment. So growth is one important factor. Probably a second additional factor is some of the things that we've already mentioned, in that adult teeth have already had a lifetime of wear. They've had dental issues, crowns, root canals, sometimes some periodontal conditions, bone loss. All of those things are important to take note of and can have a difference in how we approach adult treatment.
With 75% of Macdonald Orthodontics patients being children, it's important for parents to know at what age they should begin taking their kids to the orthodontist.
The American Association of Orthodontists recommends that a child be evaluated at 8 years of age. So many times when a child comes to see us at age 8, they won't need any treatment. So we'll put them on our growth observation program. But sometimes certain kids and certain types of malocclusions are better treated at a young age. So I would say probably about 20% of the 8-year-olds that we see go into what we call phase treatment, and the other 80% we just monitor on an annual basis until they're ready for treatment.
Some of these more specific issues that we're evaluating in 8-year-olds will be retained habits. Some kids are still sucking their thumbs at 8 years old. That can result in some imbalances of the jaws. Sometimes things get very narrow, and that can contribute to making other permanent teeth not able to grow in. Sometimes just the simplest things can alleviate many more serious problems.
There are many things that parents should be informed about when seeking orthodontic treatment for their kids, like the differences between phase treatment and all-at-once treatment, and when each of them is appropriate.
So phase treatment is where we do some work when they're young, and usually phase treatment lasts somewhere between 8 and 14 months. And then we stop and we watch them grow, and then we take a new set of pictures and talk about a second phase of treatment to finish everything up. To do a first phase of treatment, you really have to believe that you're going to have a superior result in the end by doing that first phase.
As a treatment with very specific set of goals, I always, when I'm discussing treatment with the child and the parent, list out very specifically the goals that we're meant to accomplish.
Something else parents should be aware of is the difference between certain kinds of braces.
In our practice, we don't use one specific brace. We use different kinds of braces depending on what it is that we want to accomplish. Certain braces are better at doing some things than other things. So for us, we use the brace that we think will do the best job and accomplish what we want to accomplish. Whether it's a self-ligating brace or whether it's a brace that uses colors.
Once the braces are removed, retainers become a necessary part of treatment to keep the teeth straight.
Although many dentists perform some orthodontic treatments, nothing compares to someone who has specialized training in that field.
Most of us spend anywhere from 2 to 3 years full-time learning all the concepts of facial growth, moving teeth, aligning jaws, all the things that we do.
More information about Macdonald Orthodontics can be found at macdonaldortho.com.